Now several branches arise in this canal. I'll show you one by one. First, the greater petrosal nerve. Here it emerges. It passes forwards and then it continues at the nerve of the pterygoid canal and joins the pterygopalatine ganglion. So facial nerve forms the functional component of the pterygopalatine ganglion rather than the maxillary nerve. This is the maxillary nerve which forms the structural component of the pterygopalatine ganglion. Now this is another picture of the greater petrosal nerve. Here is the nerve, continues forward as the nerve of the pterygoid canal and joins the pterygopalatine ganglion. Another branch is the branch joining the lesser petrosal nerve. Here is that. This is the lesser petrosal nerve and this is the branch joining the lesser petrosal nerve. This one. So in this way it communicates with the otic ganglion. This is the otic ganglion. Third branch is an external petrosal nerve. This one. This one. So through this it communicates with the sympathetic plexus around the middle meningeal artery. So this is the middle meningeal artery. So through the external petrosal nerve it communicates with the sympathetic plexus around the middle meningeal artery. Next is the nerve to stapedius, this one. Fifth one is a branch joining the auricular branch of vagus. This one. This is the vagus nerve. This is the auricular branch of vagus. This is a branch joining the auricular branch of vagus. So through this it conveys the cutaneous sensation from the concha. Finally, the chordae tympani nerve. Here it emerges, passes in a different bony canal, passes forwards in between the fibrous and mucous layer of the tympanic membrane at the junction of the pars tensa and pars flaccida, and emerges through anterior canaliculus of the chordae tympani nerve and joins the posterior aspect of the lingual nerve and supplies the tongue. Anterior 2/3 of the tongue. Here is another picture of the chordae tympani nerve. This wire represents the nerve. It emerges from here, passes through this bony canal. This is the middle ear cavity and emerges through the anterior canaliculus and supplies the tongue. Then the nerve leaves the temporal bone through the stylomastoid foramen. Here's the mastoid process and it's the stylomastoid foramen. The nerve emerges from the cranial cavity through this. Now from here starts the extracranial part. It gives several branches over here, rather two branches. One is the posterior auricular nerve, this one. Another is the nerve to posterior belly of digastric and the stylohyoid muscle. Now these two nerves may emerge together or differently. Now if you haven't understood yet, here is a simple diagram representing the course of the nerve. This is the motor root, the sensory root, these three are the sensory roots. So this is the internal acoustic meatus. This is the facial canal. Here starts the facial canal. This is the genu and here is the stylomastoid foramen. So it enters the internal acoustic meatus, then it enters the facial canal, takes a sharp turn, forms an external genu and emerges at the side, stylomastoid foramen. Now in the face it gives 5 branches: a temporal, zygomatic, buccal, marginal mandibular and cervical. Now the temporal branch supplies the upper part of the orbicularis oculi, frontalis and corrugator supercilii. The zygomatic branch supplies the lower part of orbicularis oculi. The buccal branch supplies the zygomaticus major, minor, buccinator muscle, orbicularis oris, levator anguli oris, muscles of the nose. And the marginal mandibular branch supplies the mentalis, risorius, depressor anguli oris. And finally the cervical branch supplies the platysma. Now this picture depicts the branches of the facial nerve in the face. Follow the yellow part, yellow nerve, because it's a branchiomotor component. Follow the yellow part. So here it emerges at the stylomastoid foramen. This is the temporal branch supplying the frontalis, upper part of the orbicularis oculi. The zygomatic branch supplying the lower part of orbicularis oculi. Then the buccal branch supplying the buccinator, the marginal mandibular branch, and the cervical branch supplying the platysma. Lesions of the facial nerve. Now what can be the causes? There can be a central cause like brain abscess, pontine glioma, multiple sclerosis, intracranial part, acoustic neuroma, meningioma, metastatic carcinoma, intratemporal part, Bell's palsy, middle ear infections, trauma, neoplasms like glomus jugulare, facial nerve neuroma, metastatic carcinoma, affecting the extracranial part, that is the parotid malignancy, any parotid surgery, and any systemic disease like diabetes mellitus, polyarteritis nodosa, leprosy, etc. can cause lesions of the facial nerve. Now to test the facial nerve, tell the patient to raise his eyebrows, tell the patient to show his teeth, observe the symmetric deviation of mouth to both sides, watch the nasolabial folds, tell the patient to blow his cheeks, and test the tone of the buccinator muscles on both sides. Tell the patient to close his eyes tightly so that you can't open, and test the tone of the orbicularis oculi muscles. Now next we come to the most common cause of facial paralysis, that is nearly 70 to 80% cases of facial paralysis are due to this Bell's palsy. Now the findings here are loss of furrows in the forehead, in this part, there is wide palpebral fissure here, there is loss of nasolabial fold, and finally there is a drooping of angle of mouth towards this side. So there can be many causes of this. They can be due to any infection, viral infection like herpes simplex infection, herpes zoster infection, Epstein-Barr virus infection. It can also be due to any autoimmune causes. There can also be a vascular cause like vascular ischemia. And I'm thankful to Dr. Saraswata Mohanty for being my subject. Thanks for watching.